Senate committee leaders joined patient advocates and community pharmacies on the steps of the Capitol this week to press for the reform of the shadowy tactics of pharmacy benefit managers, or PBMs. They're the middlemen who drive up healthcare costs and pocket huge rebate dollars from manufacturers without passing along those savings to patients.
The time for meaningful PBM reform for all of you was actually yesterday. We have been fighting this battle for months and months. And for too long, these middlemen have been pricing life-saving medicines out of reach for patients that need them for one reason. They can pad their profits, and we're here to say those days are going to end.
Our legislation will reduce the out-of-pocket Medicare medication costs for seniors, enhance accountability in our federal health care programs, and shore up patients' access to the pharmacy of their choice.
Over the past year alone, more than 300 independent pharmacies have closed across the country because of the strong grip the three largest PBMs have on the pharmaceutical industry.
What I resent most about the PBMs and their diabolical practices is that they make it harder for me to care for the people I care about most.
A bipartisan PBM reform package unanimously passed the Senate Finance Committee last November, demonstrating the growing momentum for bipartisan legislation to hold PBMs accountable. The Secretary of HHS also threw his support behind the legislation.
We are absolutely ready to work with you on PBM reform. We want to find that there will be more transparency in the way these PBMs operate. And certainly, I think we all agree, there's no reason to have middlemen in the healthcare system if they're not going to provide healthcare.
With renewed calls from both the Congress and the administration for passage of legislation to crack down on PBMs, there's still hope that patients can get access to the care they need without PBMs standing in their way. This is Bio.News.